Hello and good afternoon, everyone. This is Nicole Morris, and I will be going over the topic of schizophrenia for this week's discussion. The first topic we have is neurotransmitter theory. The neurotransmitters in a schizophrenic mind are irregular due to they have increased serotonin and prefrontal atypical increase in dopamine levels, thus creating a chemical imbalance in the neural networking systems. Increased etiology findings of serotonin levels. The antagonism of serotonin receptors shows improvements neurologically by a reduction in schizophrenia symptomologies. Treating serotonin antagonists alone will not produce effective enough treatments for schizophrenia. However, the antipsychotic chlorpromazine, Thorazine, also lowers serotonin levels by blocking adjacent receptors. The standard antipsychotic treatments for schizophrenia help reduce the overproduction of neurotransmitter systems by blocking access to the receptors, inhibiting chemical imbalances. Boyd-Kimball, ETL 2018, affirms that the pharmaceutical Thorazine is the first generation antipsychotic low-dose pharmaceutical that blocks the D2 receptors as the antagonist to block excessive dopamine efficiently. Glutamine neurotransmitter abnormalities are thought to be the root cause of schizophrenia, but there needs to be a lot more research and analyzations done. Moving on to the next slide, we're going to be talking about pharmaceuticals and how they're beneficial to schizophrenia and how they're also not beneficial. One of the most common medications for schizophrenia is generic chlorpromazine, or market brand Thorazine is what it's referred to. Thorazine is an antagonist that works as a receptor blockade that inhibits the transmission of excessive dopamine. Therefore, the pharmaceutical aids in the reduction of excessive dopamine, helping to level out the once irregularities of dopamine, creating synaptic balance. Goff 2021 affirms that drugs such as amphetamines produce symptoms in normal individuals while exacerbating positive symptoms in schizophrenic cases. Therefore, the type of pharmaceutical one chooses as treatment must be critically evaluated and not recommended to the patient until the individual who has gone through thorough assessments. Some aid schizophrenia, while other antipsychotics can exacerbate the symptomologies. Now we're going to talk about some of the benefits and risks associated with the drug. The benefits, the pharmaceutical is commonly used in treating schizophrenia and therefore well developed, researched, and studied. The medication significantly reduces symptoms associated with schizophrenia. It also acts as a blockade against overactive neurotransmitters such as dopamine, serotonin, and glutamate by blocking and binding the receptors. That's how the drug acts. Reduction in symptoms ensure the quality of life can return to a somewhat normative functioning state for the individual. Risks include increasingly if one is misdiagnosed and is having prolonged use on the pharmaceuticals, it can cause symptoms that closely resemble that of schizophrenia in a normative brain neurobiology. Therefore, proper diagnosis is critical so that life-altering brain chemical plasticity does not occur. Quada et no date affirms that Thorazine has a high fatality rate if used to treat delirium in dementia patients. Do not use delirium as a prognostic marker, meaning if you meet an individual that is delirious, don't automatically assume that they have schizophrenia. On the next slide, we're going to talk about the side effects of the pharmaceutical. And as you can see, there's blank facial expressions, dry mouth, constipation, agitation, slowed movements or uncontrollable. They can have seizures, stuffy nose, blurred visions, difficulty urinating. The list is continuous. However, if left untreated, schizophrenia, paired with inactive lifestyle as associated heightened risk factors such as higher rates of substance abuse and overall poor attention to self-sustaining qualities such as taking care of oneself, which is one of the symptoms is, not really taking care of oneself daily, like brushing their hair and their teeth. They just don't pay attention necessarily to those daily things like people with normative brain function would. Looking at the next slide, considerations if there's no drug intervention. Untreated, depending on the severity of the prognosis, patients can end up homeless or in psychiatric hospitals. A lot of family, if they don't understand the diagnosis, they just see it as a normal person maybe acting out and being maybe disobedient, defiant, and they don't want to tolerate it, so that's sometimes where they can end up. So treatment in diagnosis becomes really important. However, pharmaceuticals or choosing treatment is a no-win situation sometimes because pharmaceuticals do have side effects that range from mild to fatal. No treatment plan leaves schizophrenics struggling with hallucinations, mental confusion, aggression, amnesia, and the list is continuous of all their symptoms that they have to deal with and struggle with on a daily basis. However, one alternative could help reduce symptoms organically with minimal adverse side effects compared to the alternatives. Unfortunately, there's not a lot of research on it yet, but that is the CBD alternative. CBD may be an organic alternative to alleviating some problematic symptoms associated with schizophrenia. Interestingly enough, cannabis can reduce symptoms of schizophrenia, especially if your genetics are predispositions regarding former family members, meaning your chance of getting it is a lot exceedingly higher. However, if you separate the two main molecular components in cannabis, THC and CBD, you have an agitator and an alleviator of schizoid symptoms. Because the THC is what is a derivative of the psychosis and psychedelic derivative. CBD, however, is the alleviator of schizoid symptoms, as it helps reduce all the symptomologies. AMID ETL 2021 surmised that CBD consumed acts as an antagonist, binding the cannabinoid receptors, which there are several within the CNS. There is insufficient research or plasma bioavailability to ensure CBD pharmaceutical conclusions. So they need more, people coming in that are using CBD as a treatment and research in their plasma. The recovery and mortality. Schizophrenia is neither fatal nor curable, but symptoms are manageable through various treatments and pharmaceuticals. The natural course of the illness can be consistent, yet sometimes heterogeneous and unpredictable. Therefore, individuals with the prognosis of schizophrenia will vary with levels of various symptoms regarding the disorder. Some cases stay within consistency, while others with the illnesses may worsen symptomatically with age. Advocate ETAL all 2018 surmised that the lifespan with those with schizophrenia is usually 20 to 25 years shorter than those without the prognosis. But that could mean if you lived to be 100, you might die at 80. So there is a plethora of information regarding schizophrenia to acquisize, but unfortunately it cannot all fit into the allotted amount of time budget that I have for this project, which unfortunately I've went over exceedingly. But I could go on forever because schizophrenia is an extremely interesting topic to pick apart and analyze. Thank you all for listening, and I hope you all have a wonderful day. Thank you.